My name is Elaine Potter, and I just want to thank you all for attending our session, The Ripple Effect, Innovating Governance in Water Management. The goal of our session today is to examine the different ways in which we can see governance manifest in our different WASH programming. And we're going to be doing this through looking at a couple of different case studies, one in Kenya, one in Ecuador, and one in Ethiopia. So for today, we're going to start with an overview of the WASH governance framework. That's USAID's WASH governance framework. And then we'll go into our presentations and we'll have a panel discussion with all of our presenters that will be moderated by my colleague, Mark Graydon from RTI International. And then we'll open it for an audience Q&A. And just to get us started, I mean, as we heard in the plenary session earlier today, governance in the context of WASH is multifaceted and it encompasses a range of actors, systems, and processes. And it is more than just the government actions or the policy writing or the training sessions. And so in being able to improve governance starts with a thorough system analysis and thoughtful partnership. And recognizing the complexity of WASH governance, all of our interventions should begin with identifying opportunities and constraints, followed by establishing or strengthening our partnerships. And so I'm going to hand it over to Mr. Faisal Hashi, the Water Security, Sanitation, and Hygiene Advisor from the USAID mission in Ethiopia, before we go into our presentation. Here we go.
Thank you very much, Elaine. Thank you all. Once again, my name is Faisal Hashi. I'm the Water Security, Sanitation, and Hygiene for USAID Ethiopia. Before the presenters lay down their work in WASH governance, I would like to provide a brief overview of USAID WASH governance framework. The framework that you see here is on the website as well. It's a summary of our technical briefings outlined 3 key pillars. And these pillars are policy framework, institutions, whether it's national or international, and governance processes. Whereas these principles stress the importance of transparency, this is a big issue in the South, participation, effectiveness, and efficiency, and accountability as well. Collectively, the pillars are principles and cross-cutting issues, reinforcing one another. They highlight entry points for technical assistance and capacity building for the WASH sector, facilitating systemic governance improvements. When we speak of governance in WASH, there are a lot to consider. For example, the policy framework for effective WASH governance may be affected by national or local governments. Policies as well as cultural context, social norms, sometimes negative, sometimes positive, and prevailing power structures. Together, these pieces shape stakeholder interactions and guide WASH governance. Similarly, institutions can range from formal bodies or entities such as WASH service providers, local governments, traditional institutions, private sector, youth groups, and CSOs. These pieces shape the intersection, these pieces shape the interactions and guide WASH governance actions. Governance are formal and informal, okay? Which means that realizing the functions and performance of governance include articulation of institutional mandates. Conflict resolution. Conflict is a big major issue in the WASH sector, especially in the water scarce areas. Law and policy, making information sharing and others accountable. I look forward to hearing the presenters apply and touch on implementing the framework that we see here, and it's on the website if you need to see further information. Thank you for your kind attention. And I will pass the torch to Elaine, who is the session moderator. Thank you.
And then we'll hear our first presentation. Rosalind, did you want to come up? Rosalind is our Deputy Chief of Party in the USAID Western Kenya Sanitation Project.
Thank you very much, Elaine. So I will take you through how we implement the pillars, the governance pillars within this project. So the USAID Western Kenya Sanitation Project is a 5-year project being implemented in 8 counties in the western part of Kenya. So this is the very first time that USAID allocated this amount of resources specifically to address sanitation and menstrual hygiene management challenges. As you're well aware, for a very long time, sanitation and hygiene have been less prioritized. And so through this project, we are actually implementing it through a market-based approach to address these solutions. So our main goal is to work with key actors that include the county governments and private sector actors to develop a financially sustainable, transformative, and most importantly, a locally owned sanitation marketplace in the region. We envision that after the 5-year period, we will have 500,000 people accessing basic and safely managed sanitation services. We are guided by 3 main objectives as we implement this project. The very first one is to increase access and uptake of market-based fecal sludge management services and sanitation products and services. The second one is to increase access and uptake of market-based menstrual hygiene management products and services. And lastly, which is very relevant to this presentation, is to enhance or strengthen the capacity of county governments to effectively plan, manage, and finance market-based sanitation and menstrual hygiene management interventions. In terms of the pillars and how we implement them within our project, when looking at the policy framework, first of all, we are guided by the Constitution of Kenya 2010, which was enacted in the year 2010, and whose main objective is to ensure that all citizens of Kenya actually have access to the highest standards of sanitation and water. This is complemented by the Kenya Vision 2030, which equally aims to transform Kenya into an industrialized middle-income country by 2030. So ensuring that there is 100% coverage of sanitation and water services. So other than that, at the national level, we have a number of policies that guide our implementation. The very first one is the National Environmental Health and Sanitation Policy, which came into place in the year 2016 to 2030, and speaks towards the implementation of market-based sanitation approaches and the role of key actors from the government to the private sector actors. We also have the Menstrual Hygiene Management Policy that was enacted in 2019 to 2030. So this policy provides guidance in terms of how do women and girls access menstrual hygiene management products? Are they able to manage their menses in a hygienic and safe manner? Do they have access to information and knowledge with regards to menstrual hygiene management? So with the enactment of the Constitution of 2010, this led to the devolution of water and sanitation services to the county governments. So how well these counties are able to actually plan and finance sanitation will really just provide proof as to whether that devolution actually works or doesn't work. In terms of the institutions that we work very closely with, we work with the Ministry of Water, Sanitation and Irrigation, and also the Ministry of Health, whose main role is to legislate, provide policies and also strategies with regards to increasing access to safe water and also on sanitation. So specifically on sanitation, how we work with these institutions, we are currently in the process of developing market-based sanitation guidelines and also the menstrual waste management guidelines for the country. So working very closely with these 2 ministries on that. We also work with the Water Services Regulatory Board, whose main mandate is to regulate water and sanitation service provision. So specifically for sanitation, there is currently a paradigm shift from, just purely offering seaward sanitation services, but now we are also looking at non-seaward sanitation services. So in terms of how do they provide guidance in terms of regulating this particular sector in terms of sanitation. Then also the Water Sector Trust Fund, and specifically on sanitation, encouraging them to provide grants, both conditional and non-conditional, that are able to address sanitation challenges and really work closely with the water and sanitation service providers. At the county level, we work very closely with the water and sanitation service providers, whose main mandate is to offer water and sanitation services to the citizens. In terms of the processes that we've been able to support, there is a citywide inclusive sanitation. So this one specifically for one of the counties where we have been able to work with a number of actors, both state and non-state actors, to develop a citywide inclusive sanitation plan that aims at ensuring that everyone within that city actually has access to sanitation. We are also supporting the counties to develop strategic sanitation and hygiene investment plans. When we came into these counties, majority of them could not actually even budget for market-based sanitation interventions, or were not even aware of how exactly they would start implementing market-based sanitation interventions. So with the strategic sanitation and hygiene investment plans, they're able to now identify the financing gap that they have and approach donors or private sector actors to support them in filling in those gaps. Then as a country, we recently launched the National Water and Sanitation Investment Plan in the year 2023. And again, the main objective is just to diversify the financing mechanism, but also bring on board a number of actors to support with the implementation of water and sanitation service provision in the respective counties. So this has actually been rolled down to the counties, and in each of these counties, they actually develop 5-year county integrated development plans. So within the 5-year period, what do you envision as a county in terms of increasing access to sanitation and menstrual hygiene management? So we supported them through that, because when they were developing that, it was in 2023 when we had just come in as USAID Western Kenya Sanitation Project. And subsequently, we have been working with them to develop their annual work plans, where we just look at, hey, have you been able to allocate some resources? And if you are, have they actually been utilized for the intended purposes? In terms of the interventions that we have undertaken, we began by supporting the counties to domesticate the national policies. So this has been a process, because remember, the policies that were in place were at national level. All these services have now been devolved to counties. And so in each county, with their different contexts, they actually need to have policies that speak to market-based sanitation and are pro-private sector participation and investment. Other than that, looking at aspects of strengthening access to finance, both public and private, and we are working very closely with financial institutions and a number of private sector actors, from manufacturers, suppliers, to support us in facilitating the development of the sanitation and menstrual hygiene management market. We also undertake interventions with regards to institutional strengthening, specifically on sanitation. And looking at the water and sanitation service providers, majority of them focused on seaward sanitation services. So how do we bring on board the aspect of the non-seaward sanitation services? So working with them to really help them understand. At national level, Water and Sanitation Regulatory Board developed the Urban Sanitation and Inclusive Guidelines. And so we are working with the WSSPs and with WASREB to ensure that the staff actually have the capacity to understand and implement that. We are partnering with a number of actors, just as I have said, but also ensuring that all our interventions are actually participatory and, undertaken through a multi-stakeholder approach. So for example, with the citywide inclusive sanitation plan, we are not just going as USAID Western Kenya Sanitation Project, because we know that there are a number of actors within this space who support this intervention. So how do the other stakeholders come in, and how do we pull in our resources to make sure that we support the county governments to address these issues? So in terms of the considerations we put in place, our interventions are actually county-led and county-owned. And we started this off as we were initiating the project. So we developed joint work plans with these county governments, and on a regular basis, on a quarterly basis, we look at the joint work plans that we developed, and are we able to assess our performance, both from the county government side and also from USAID Western Kenya Sanitation Project. And we look at it, hey, it doesn't really have to be, you've allocated some finances, but there's that technical support that you have provided at the end of the day, there's some responsibility that you have taken in terms of helping us implement this particular project. So this is a step towards ensuring that the counties actually take up these interventions and implement them. We are also rolling out an innovated blended financing mechanism to support more market-based sanitation interventions. And we are doing this through an implementation research with WashPulse. I've talked about, capacity strengthening in terms of how counties effectively plan and budget for sanitation and menstrual hygiene management. Then lastly, that aspect of regulation of sanitation and FSM delivery, fecal sludge management. So for that, you realize that especially for non-seaward sanitation services, we are working with these counties to develop standard operating procedures that provide guidance into how do, manual pit emptiers, how do we formalize them and how do we recognize that they're actually part and parcel of the sanitation value chain. In terms of the impact that we have had, we realize that policy formulation and implementation is a long process. So we have successfully done that in one county where we've actually launched the menstrual hygiene management policy, and in the other counties, we're in the process of supporting the domestication of these policies. So it's just not about domestication. Once again, it's more about, yes, you have domesticated the policy, but what next in terms of financing to ensure that, there's also an implementation framework for these policies. For the water and sanitation service providers, like I said initially, those very high prioritization of water provision and water, with less focus on sanitation. So we have worked with the water and sanitation service providers to develop business plans and strategic plans for their companies with a focus on sanitation. So how much revenue do you think you can get out of sanitation service provision? The strategic partnerships that we have had with financial institutions have actually resulted in us, mobilizing about 9.3 million Kenya shillings through, private sector engagement in sanitation and hygiene. So those have been our outcomes. So in terms of the challenges, I've talked of, access to finance being quite a major challenge. And when you look at the sanitation business environment, majority of the actors within this space are actually small businesses and like hardware stores and all. And we've been working with the county governments. How do we incentivize them to continue with this business? Because financing them is also quite a challenge, and they have very huge challenges with regards to, collateral and not being able to access the financial product. So how do the county governments also help us to just have some flexible mechanisms in place, or just have county-led private sector engagement policies just to ensure that these actors remain within the business? Then I've talked about lack of prioritization, budget allocation, and utilization. So at the start, when we were doing the county integrated development plans, we made these beautiful plans, or this amount of money has been allocated to sanitation and menstrual hygiene management. But the challenge comes in at actualization level. How much have you allocated for sanitation and actually utilized it? In terms of lessons, we've realized that there is actually a need for blended financing, especially for market-based sanitation and menstrual hygiene management interventions. The mainstream commercial financing is just not really working for the sector. And so if more actors can just come in to incentivize this particular sector, then that will really work well with us. The aspect of, multi-stakeholder involvement and participation has also been a really key lesson to us that will contribute to the sustainability of our interventions. In terms of the recommendations that we have, it's really important to develop and build the capacity of local development organizations to champion governance issues at the grassroots level. So for USAID WKSP, we also have a flexible funding mechanism that allows us to work with grantees who are at the grassroots level, and we are able to support them in a number of interventions. Other than that, designing programs that really support the evolution of these services and build stronger accountability mechanisms. It's really important to strengthen the WASH networks, work with a number of partners, because speaking with one voice will help to support county governments to really deliver on their mandate. Then promoting, permanent spaces for community participation. And lastly, really just strengthening the aspect of having reform champions even beyond the WASH sector to ensure that everyone is involved and everyone is heard. Thank you very much.
Great. Thank you, Rosalind. Our next presentation is going to be from Carlos from the USAID Ecuador TuMUNI project or activity. Apologies.
Hi, everyone. My name is Carlos Arias. I am the water and sanitation lead for TuMUNI project in Ecuador. So I'm going to talk about our experience working in Ecuador. But first, I'm going to put some context about TuMUNI activity overview. TuMUNI is a 5-year project in Ecuador. We already have implemented 1 year. So today I'm going to share with you the first learnings that we have. And also I'm going to explain how we use these pillars into the process and the success history of Pajan, a small municipality located in the coastal region in Ecuador. So TuMUNI purpose is to strengthen the capacity and functionality of local municipalities to provide important public service for the livelihoods and prosperity of their citizens. TuMUNI works with local governments, civil society organizations, and national and regional institutions to strengthen service delivery system through increasing the capacity of local governments and service providers, and through the coordination of public policies and guidelines among relevant stakeholders. So when we start working with TuMUNI, we identify the policy framework. So Ecuador has a very particular policy framework. So the most relevant aspect for Ecuador is the private sector is not allowed in the provision of water and sanitation services. It's very limited and it's uncommon in Ecuador. Indeed, there are 221 municipalities in Ecuador and only one allows the private sector participation. The remaining municipalities must provide by their own. So the local government must provide the resources for the municipalities to provide the service. So everyone here can imagine that there are no enough resources to provide all the services in all the Ecuador. So the water and sanitation service provision is delegated to the municipalities. So we have, again, 221 municipalities that are responsible for provision of water and sanitation with a lack of resources. So talking about institutions, TuMUNI is working with 30 municipalities split in the 3 regions in Ecuador. We have 7 municipalities in the coastal region, 8 municipalities in the Andean region, and 15 municipalities in the Amazon region. Most of them are in the jungle of Ecuador. So it's a challenge for us working with this kind of municipalities. In the coastal region, there are some issues regarding violence, cartel violence, so we have to work with this environment in the coastal region. In the Andean region, we are working with municipalities that are located 40,000 meters above the sea level with indigenous communities. It's a challenge for us to arrive there to provide the technical assistance. In the Amazon region, everyone here can imagine how the weather in the Amazon is. So it's a challenge for us as well to go there to provide this technical assistance. And in Ecuador, there are 3 types of water and sanitation providers. The first one is the municipalities itself. Through the structure of the municipality, they provide the water and services with small units. Most of the time, these small units are 1 or 2 persons responsible for managing the resources and provide the water and sanitation services to the communities. The second one is the public companies. So these mid-sized municipalities, maybe 300,000 inhabitants, they have their own public companies that are responsible for water and sanitation provision. And there is a third group, there is the communitary water and sanitation providers, where the municipality cannot satisfy the needs where the public companies neither, there are the community water and sanitation providers. The community organize themselves and look for the resources and provide themselves for the water and sanitation. They are recognized by the national government. So as you can see, we are working in 3 different regions, geographical regions. We are working with 3 kinds of different water and sanitation providers. And also we are working with 3 different sizes of municipalities. As I said before, we work with municipalities that are considered medium-sized, 300,000 inhabitants in their municipalities. These municipalities have their own public companies to provide the service. Then we work with medium municipalities, more or less 20,000 inhabitants. And we work also with small municipalities in the very rural regions, like the Amazon region, with more or less 6,000 inhabitants. So you can see a wide range of regions, a wide range of service providers, a wide range of size of municipalities. So with this reality, we have worked with the first 10 municipalities in the first year. As I said before, we planned to work with 30 municipalities along these 5 years. And the first year we have worked with 10. Now we are going to include 10 more. And after 6 months, we are going to include 10 more. So from April of the next year, we are going to work with 30 municipalities at the same time. So the strategy that we have developed starts with a quick win strategy. So we have selected quick interventions in those 10 first municipalities to attend the main needs that we identified. So this was a process of consultation with the community, with the local authorities, with the technicians, with the stakeholders, and we decided to implement this strategy of the quick wins. So after this, in parallel with this strategy of quick wins, we have developed infrastructure assessment to evaluate how are they working. What is the status of the assets? What is the status of the infrastructure? And what are the opportunities to intervene and to improve the services? And also, we are working with aligning the actual plans that they have. For instance, the water and sanitation plan for every single municipality, or the development plans, call it planes de ordenamiento territorial in Spanish. So we have collected all the available information to clarify and to define a proper strategy to work with. Talking about the activities, the first process or the first component that we consider is the community engagement. We are implementing this strategy according with the demand or the needs of the community, of the users. Through the public dialogue, we include them in the decisions, we include them in the processes, and we define this first step that I told you before, that the quick wins. Of course, we have to consider some governance considerations, like the regulatory framework. So it's most relevant when you identify these different kinds of water and sanitation providers. Each one has their own regulatory framework. For instance, the community providers, they have their own rules. So we have to adapt and we have to work with their rules. Public companies has their own rules, so we have to work with them as well, and the municipalities in the same way. And also we have to coordinate all these interventions with the central government, like environmental minister or another agencies that are related with this water and sanitation provision. So the citizen engagement is key for us, especially in this case of Pajan that I'm going to talk now. So in the case of Pajan, this is a small city that is located in the coastal region with more or less 20,000 inhabitants. And it has, we identified a very interesting opportunity in there. And the fact that they have a very strong woman as a mayor. It's a young woman in a poor municipality that is very enthusiastic to work with and to improve the water and sanitation services for their inhabitants. Pajan has more or less 30% of population that is not covered with water and sanitation. So one of the first objectives of this measure is to reduce this gap in the water and sanitation provision. So we identify a specific neighborhood where the people does well, the people don't receive water, and also they are connected to the system, but they don't have any kind of system to measure the water that they are consuming, and they are paying a flat rate. Despite they are consuming or not, they are paying. So people was complaining about why are they paying if they are not receiving the service. And also they have past debts that has not been covered because they don't have enough resources to that. So through the intervention of TuMUNI, we facilitate the dialogue between the community, the authorities, the technicians, and the other stakeholders to create a solution. And the solution is provide micrometers to them in order to quantify the amount of water that they are consuming with the commitment of the population, of the people, sorry, to pay the past debts and to pay the fair rate for the water that they are consuming. So 88 meters were installed, and also the incentives to payment and were developed with the government. So we provide the equipment, the people commitment to pay the debts, and the municipality commitment to develop a new local law to allow they to pay the past debts. So with this intervention, we are looking to is a strategy to cost recovery, to quantify appropriately the water resources, and to incentive to the community to engage in the processes, to believe in their authorities and be part of these processes. We faced some challenges at the beginning of this process. First, the political will. It was a very challenge at the beginning, but luckily we identified this major that is willing to work with TuMUNI. She is a strong leader, and the community believe in her. So that's a good way to start this kind of project. Then the sustaining community engagement. How are we going to be able to keep the community engaged in the process through the public dialogue? Every week we organize these kind of dialogues to understand what are they looking for and what are the commitments that they are able to assume. Defining the quick wins, identify this. In this case was the micrometers. They were asking for this. And this was very interesting because through the meters, they were asking for some kind of recognition, some kind of dignity to be considered citizens. And of course, the citizen understanding of commitment, trying to make them to commit to pay the past debts. Lessons. We learn a lot about this process. In the picture, you can see Dennis. Dennis is the director of the unit water in Pajan. The unit water has 3 people working in the unit water of Pajan. They are responsible for providing water to maybe 10,000 people in the urban area of Pajan. In this picture show the day that we deliver some equipment for leak detection and micrometers as well. It's a poor unit, a weak unit with a strong major again. So this municipal open door strategy for citizen engagement was a key aspect for us. Every single day that we have any complaint for the citizen, the major was present. The major was the person who was explaining the situation to the citizens. The municipal and citizens' commitment to participation, yes, when the municipality provides this equipment and these facilities to pay the debts, the people start to believe in their authorities, and that was key. Recommendations about our intervention. So the community commitments to participation in public processes and citizen engagement, as well as bill payment, requires continuous reinforcements through public dialogue and quality public service. I always say that the intervention doesn't finish with the picture. The intervention finishes with monitoring and being part of the trying to guarantee that these commitments will be compliant. Effective communication campaigns to complement governance interventions are critical to socialize public awareness and buy into efforts to improve governance systems in water and sanitation. So people must believe in their authorities. If you identify a strong leader, a strong politician, a good major, try to keep them in this way. Just commit to achievable objectives. Local leadership and champions within the municipality service provider and within the community can help reinforce governance, strengthening interventions in WASH. So we identify these key players, these key actors we call them our champions. So they are local leaders who engage the rest of the people in this decision-making process. So strengthening the transparency and accountability mechanisms can be achieved by building trust through targeted outreach between local leaders and service providers and local community. So these transparency mechanisms are not only to show in the website what are you doing. These are field work. In this case, the major go to the field, talk with the user. They receive this feedback from the major directly, so they know that they are talking with the maximum authority in the city. So that is a good way to transfer this confidence into the users. And finally, community participation in local management of wash services is a key launching point, but it's not the end. It needs to be sustained through wash governance improvement efforts. That is our experience talking about Pajan. At the first year, we are going to try to replicate this experience, this governance exercise along the region, in the Andean region as well, and also in the Amazon region in the next months. So I will be happy to stay here after 3 years to share more success stories from Ecuador. Thank you.
All right, everyone. So we're about halfway through the session. I know we're in the post-lunch haze, and so we're going to take a quick break. Everyone's going to stand up. We're going to re-energize ourselves before we get to the second half of the session. And we're going to stomp our feet as loud as we can. Shake out our arms. Oh, I'm back at being a camp counselor. We're going to make a funny face. Okay. Everyone feeling energized? Okay, we're gonna sit back down, because if you fall asleep during the sessions, then I don't know what you're gonna do when we ask you to ask questions. So, and we're gonna hand it over to our final presenter, Mr. Getachew, who's the Deputy Chief of Party in the Ethiopia CR Wash Project.
Okay, good afternoon. Now we are flying back to Africa, to Addis Ababa now. So I will take through Ethiopian context, Ethiopian case. As Alain said, my name is Getachew. I am Deputy Chief of Party for Climate Resilient Water, Sanitation and Hygiene Activity, which is USAID funded for 5 years. We have already gone 1 year. So just to talk about the climate resilient wash, the goal is actually to expand access to improved water and sanitation services for pastoralist communities, actually in lowland areas of Afar, Somali, Oromia, and South Ethiopia. This project is planning to reach access to water and sanitation to 825,000 people in these difficult lowland areas. The primary objectives are actually 4. The first one is professionalize and expand quality climate resilient wash services. This is actually just reaching in water service, water professionalize, advance the existing management systems, and also professionalize the power supply for pumping water services in pastoralist communities. The second objective is, which is actually interrelated, increase sustainable access to and use of sanitation and hygiene, including menstrual health and hygiene products and services. The third one is improve gender power dynamics. This has been most of the case, it has been cross-cutting, but now it is self-standing IR. And the fourth one is strengthening the enabling environment to make access to the 3 interrelated results. Just to go through, in terms of wash governance, with these 3 pillars, policy framework, institutions and processes, just as like it is told from Kenya, Ethiopia has also Constitution of 1994, which has 2 important articles in this constitution. The first one is Article 44, which speaks about every citizen has the right to live in clean and healthy environment. And the second one is Article 90, which says if the resource allows or permits, every Ethiopian will have access to public health services food, clean water, and social security. So based on this, the other sectors like health, water, education, and women and social affairs have designed their own policy and strategic framework, which is actually supporting WASH governance, WASH implementation in the country. So we are, as a CR WASH, we are using these strategies and policies. Just to mention, One WASH national program is actually the most important and flagship program for the government of Ethiopia, which we are also supporting through CR WASH activity. So it is the project, or One WASH, is just a 4-ministry flagship program, which is Ministry of Water and Energy, Ministry of Health, Ministry of Education, and Ministry of Finance. In each sector has its own roles and mandates to manage this. It is a very flagship program for Ethiopia. When you look at the ministries, the institutions that are responsible, Ministry of Water and Energy is the lead for WASH services in Ethiopia. Ministry of Irrigation and Lowlands, which is actually more responsible for the pastoralist communities of these CR WASH implementation areas, and also Ministry of Women and Social Affairs. The government, there are regional governments as well, like all ministries have their own representation at regional, zonal, and woreda levels in Ethiopia. It is also, this WASH governance is not only the government responsibility, there are also the informal committee like WASHCO, Water and Sanitation and Hygiene Committee, which are actually informally established per scheme in Ethiopia, which actually says per scheme there are at least 7 members, out of which 50% should be women. And also out of this also women should occupy key leadership positions like chairman, vice chairman, and also cashier. So we have this type of arrangement in Ethiopia. Nowadays also in South Ethiopia, there is water user associations are coming. So more in other places, WASHCO is working. The other way, the water user association is also working. So we are working closely with them. The other one is in doing these processes, we have rural water infrastructure management and planning, specifically in doing rehabilitation and construction of water schemes in pastoralist communities. We are doing pre-construction assessment in those areas to plan accordingly. The other one is there are different policies and strategies in Ethiopia, but most of the policies are not favoring to the pastoralist communities. They are not tailored to the pastoralist communities. So what CR WASH did is actually we have done the context analysis of sanitation and hygiene in pastoralist communities, and we have designed sanitation and hygiene implementation strategy, which is tailored to pastoralist areas. So this is one of the strategy which we are seeing the results. Recently, in like 6-7 months, we have reached more than 1,900 household toilets with this strategy. So the other one is gender and equity plans and strategies. We have done also gender analysis in these pastoralist communities, including social and institutional assessments. And also we have done, we are working on transiting humanitarian approaches into development WASH approaches. So we are in the process now just to come up with how we can transition from this, because most of the pastoralist communities are emergency-based type of services that are provided. So we need to transit into development-based approach. When you look at, when you look at the contextual governance challenges, we have low implementation capacity, specifically at woreda level in Ethiopia. And also there is high staff turnover because the pastoralist communities are arid and semi-arid areas where there is no infrastructure for road infrastructure, the telecom infrastructure, and other facilities are not available. So people, employees, or staff of the government are regularly moving to other places. The other one is there is limited data availability in pastoralist communities. So just to start with CRWASH, we were in a problem to have access to data. So we are now actually instilling, like coming up with digitalized water service asset management, the pre-construction using M-Water and others. Now we have adequate or ample data in our hand. The other one is in pastoralist communities, there is greater emphasis on emergency rather than sustainable wash management. So that is a big problem. That's why we are preparing to transit from this humanitarian to sustainable wash programming. The other one is less engagement of private sector in pastoralist communities. So we have done to understand this, the viable private sector engagement assessment in more than 345 wholesalers, retailers, and also masons and other service providers in 4 regions. So that helped us to understand how we can actually develop or strengthen the private sector engagement in these pastoralist communities. The other one is the WASHCOs and water user association have limited capacity to manage water supply schemes. Actually, in most cases, the WASHCO water management is a bit limited because of their capacity. Specifically, in pastoralist communities, women are more vulnerable to water scarcity, so that they move to fetch water very far distances. And while in WASHCO, they are not part of that WASHCO management, scheme management. So that is a big problem for us. And now CRWASH is working more to balance the women membership and also to encourage to have leadership positions in WASHCOs. The other one is actually the approach. Related with this approach, we have systemic analysis and also partnership. The systemic analysis, we have done stakeholder mapping, which organizations, which government stakeholders are more collaborating with us, and we have established a good collaboration. And also we have done political economy analysis just in Somali region to actually for 2 reasons. One is to understand how is the WASH coordination in pastoralist communities, specifically in Somali, and also the second one is how WASHCOs are functioning in Somali region and at water point or water scheme level. So that is really helping us to understand more in these pastoral communities. The other one is review of existing national local government of Ethiopia guidelines for sanitation and hygiene, asset management, and also disaster risk management and water conflict assessment. As this was mentioned, specifically water conflict management strategy, we have done assessment in the pastoralist communities. We have developed the water conflict mitigation strategy already. So that is, as we all know, water is a source of conflict, specifically in bordering of the pastoralist communities. Somali with Oromia, Oromia to Afar, Somali with Afar. So we have done a good water conflict mitigation strategy to alleviate such type of problems. The other one is partnership. In the partnership, we have based on the USAID's sequencing, layering, and integration approach, we have identified different USAID implementing partners. So we are working more with like groundwater mapping, for example. With groundwater mapping, we have already identified the partnership with Addis Ababa University, Africa Center of Water Management. So we are working with them. And also we have identified some market system development in different USAID implementing partners, and we are working together. The other one is local government entities, agencies we have identified different local entities to work with, and also local leaders. Specifically in pastoralist communities, there are religious leaders, clan leaders. So we have identified those, and we are actually using them to reach at community level, at household level. So this is a really a good approach. The other one is ongoing activities. You can see it from infrastructure management perspective. We are not only focusing on the infrastructure alone, we are also focusing more on software component, just through the community engagement or community participation. We have digital water service asset management, and also we have climate resilient water safety planning, which we have provided training to Warada water engineers and experts, and we are now planning water safety plan. Enabling environment, we have done quite a lot of enabling activities, like we have prepared modified CLTSH market-based sanitation and social behavior change communication, which we have applied and seen a good result. And also innovation and transformation aspects, we have done quite good change. Just to what we learned from this process is actually there is a need to focus on cost recovery and sustainable wash scheme operation and management. Specifically, wash costs in Ethiopia are dependent on the government support. So we need to make sure that wash costs will be able to recover, use the cost recovery mechanism. So the other one is more we are going to engage private sector. We have already providing also different micro grants to engage the private sector at community level. So that is the lesson, and there are other lessons as well. Just to next steps, the first one is focus on local level management and technical capacity building, specifically the Warada and the Kabale level. That's WASHCO and Warada WASH team capacity building. The other one is collaborate with local entities like TVETs, technical, vocational, and educational training centers, engage and incentivize local private sector players at community level, and put in place accountability mechanism and also community participation. More importantly, the clan and religious leaders are very, very crucial, very vital for CR WASH. So thank you very much.
Thank you to all the speakers. I think we all got to hear a number of different examples of active projects that are really trying to tackle a number of the WASH issues and are all addressing some of the governance challenges. So we are going to have a short moderated session, and then we're going to open it up to Q&A. So I will start that now. My first question is for Faisal. From your perspective, what does USAID's WASH governance framework tell us about the types of challenges we are facing in the WASH sector, and what types of interventions and approaches are needed? Are there specific areas of support that have been particularly impactful in building strong policy frameworks and institutions?
Thank you very much. Types of challenges. Challenges are too many in the WASH sector in the global south. So one of the challenges, the obvious one, is the finance. So there is no enough financial evidence to provide all these financial shortfalls. Now, another challenge is the technical know-how. Those who work in the WASH sector and those who are well experienced, especially in the academia and the technical know-how, tend to migrate from south to north. So that's another challenge. Within the national countries, they tend to move from regional into the capital cities. So that's another challenge. The framework, the governments tend to change their policies from time to time. I mean, you work with the government and the minister changes or there's a reshuffle, then the whole policy is turned upside down. So the challenges are too many. We can go all day talk about the challenge, and I'm really good about talking about the challenge.
Do you want to provide any areas of success? Faisal?
Yeah.
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 Maybe.
Let's talk about the challenge. Success. I mean, success. It's for example, in Ethiopia, we are implementing to include the private sector because private sector is normally seen as something that has nothing to do with WASH. WASH is government-led in Ethiopia. So private sector, the private sector coming into the WASH sector, that's a very, very good success, especially for the CR WASH in Ethiopia. So we are pushing the private sector to take advantage of the benefits of WASH. Yeah.
Thank you. My next question is for all of the panelists, and it's about transparency. And can you talk about how transparency or lack of transparency on things such as budget allocations affect accountability and how customers trust or do not trust water and sanitation institutions? And what mechanisms or tools do you use to promote transparency? And as I said, it's to all panelists, so please all answer.
I hope it's on. Yes. So transparency affects a number of aspects, especially with regards to water and sanitation service provision. So first of all, I think the underserved are the most affected, or the poor segment of the populations, because one, lack of transparency leads to an equal distribution of the WASH services, where you'll find that mainly it's just the political part of the or segment of the population that gets to get these resources, but there is a segment that does not get the resources. Number two, it also affects just even the timelines of implementing a water project, for example, because you're really not clear, first of all, even in terms of the resources that have been allocated for a particular project, and you find that the resources are actually diverted elsewhere. So that leads either to incomplete water projects, or even if they're not complete, the quality of the services or products that are out there are just not really up to standard. So in terms of how to address all this, I think first and foremost, multi-stakeholder participatory approach is very key, where we have all actors, especially the communities who really understand their needs and what they want done, need to be involved from the planning to the implementation and through the whole process in terms of even how the finances have been allocated for a particular project. Number two, I think it's also important to make sure that whatever interventions we are undertaking are actually backed by some evidence. Basically, is there a need for undertaking a particular intervention? Why are you undertaking it? Are you actually responding to a particular intervention or a particular need that has been brought out by the community? I think something else is the aspect of monitoring. So it's just not about, hey, we have been allocated these resources and we are going to implement it in this particular way. So just making sure that all key stakeholders are involved from the inception to the planning and throughout the whole monitoring and evaluation process, just to strengthen and ensure ownership. I think probably also lastly, just making sure that control measures are put in place in all institutions that are relevant to a particular project. So, and this includes from procurement, of the contractors who is coming to undertake this particular activity. Have you done your due diligence to ensure that whoever is undertaking this activity has actually been, checked to ensure that they have the capacity to actually deliver? So basically just strengthening the institutions that are mandated to deliver on water and sanitation service provision and making sure that they play their part in terms of making sure that everything is transparent in terms of budget allocation and utilization for water and sanitation service provision. Yeah, probably I'll hand it over to you, Carlos.
Yep, sure. I just can add that in the Ecuadorian context, maybe we misunderstood what transparency means. So we consider after these first years of implementation of TuMUNI that the transparency exercise starts with the involvement of the community into the beginning of the process. I agree with you when said we should include them in the inception. Yes, but also we have to include in the selection, in the prioritization of the investments, and also in the monitoring, and also in the evaluation process as well. So when we can note that if the citizen believe in the authorities, believe in the politicians, the next steps are easier to us. And it's more easy to follow up, and it's more easy to monitor the intervention if the citizen is involved, if the citizen is engaged into the process. So yeah, for the transparency, I also recommend that try to identify these key players from the beginning and start with this process of involvement into the decisions. And finally, I can say that for TuMUNI, from TuMUNI experience, this should be, or I recommend to, it could be a training process as well, to explain to the citizens what are their rights, of course, but also the obligation that they have to comply as a citizens as well.
On. It's on. It's on.
Okay. Is it working?
It's working. It's
Okay,
working.
thank you very much. Actually, just to complement with my colleagues, I will take an example of WASHCO management actually. In WASHCO management, communities want to know how much user fee is collected from at WASHCO level, at water scheme level, and how they also deposit to the bank account, so that whenever they are more transparent and people know how much budget they gathered or the revenue they collected, then they can follow what is happening in that water scheme. So in particular, we have observed that type of issues in actual implementation of climate resilient WASH activity in pastoralist communities. So whenever the WASHCOs are more transparent, then community will trust them very much. So they will contribute the user fees every time, even more. So they have also, based on this, they have also a mechanism of especially considering this marginalized or vulnerable group to exempt user fee payments in those communities when they are clear and transparent. So that is something. And regarding to accountability, for example, in WASHCO, WASHCOs are serving as volunteers. Unless they are insured, legalized entity, they are volunteers. So accountability is very limited to them. So legalization is very important for the future to make sure that they are accountable. Thank you.
You want me to add? Yeah.
Thank you.
I think it's on. Yeah, yeah. Transparency. It's a word that is not well known in the global south. So water users or end users are always suspicious of the water service providers. The reason being that the governments don't consult at the design of the activities. So it's a sort of a top-down development. If communities are taken into account at the design of the activity, then transparency would be more appreciated. So it's a top-down development, and there's always that suspicion that the government is not doing a good job. Thank you.
I just wanted to add, in my country right now, I think we are undergoing what is called the Gen Z revolution, where, they're really coming out to hold the leaders accountable for all promises or all commitments that they've made. So I think one aspect that is also very important when it comes to transparency is ensuring that we also empower our communities to really understand their problems and what they need to do in order to address them. So with this revolution, at least for now, we know that there's a generation that really understands what they want. And it's actually even motivated the older generation to now really just pick up and say, hey, this is not right. So I think when we move to that direction where everyone is empowered, understands their challenges and what needs to be done, and is aware that this amount of resources were allocated for this project, then you can be able to also hold the political class to account so that they can ensure that services are provided for.
Thank you. Okay, our next question is for Getachew. It's about participation. So can you talk about I know you mentioned increasing, I think, gender representation at the WASHCOs, but can you talk about any of the unique challenges that you faced in achieving that or having inclusive participation of marginalized and vulnerable groups, and what strategies you have used to create spaces for dialogue to get these people involved in the process?
Okay, thank you very much. Actually, related with this inclusion of marginalized and vulnerable group is actually from the design itself. It is WASH design is inclusive. In one WASH national program, there is inclusive design. We are also using, as CR WASH, we are using that inclusive design. It is actually, when you look at the inclusive design, it is at scheme level, which is inclusive. But a household living around in 1 kilometer radius or 2 kilometer radius, if there is unable to walk and using wheelchair, cannot come because it is a rural area. There is no comfortable road to come with wheelchairs. So that is the main problem we are facing. Otherwise, the design itself is inclusive. The other one is actually not only design, through the implementation also we are checking with communities engaged throughout implementation, as well as monitoring our achievements or our activities. The marginalized and vulnerable group are also part of it. Specifically, more elderly people, for example, they are more included. Clan leaders and also religious leaders who are elderly, they are more included in the process. So they are part of the entire process. Related with also the gender issue, the gender we have also included in the intervention. So that is something we are doing in CR WASH. And the other one is the platform that we do this dialogue specifically is there is community gathering at village level. So during that community gathering, there is a debate or a discussion about different issues like sanitation, water supply, and other related problems in the area. There is also in Ethiopia, there is at community or household level, there is a coffee for house type of discussion. Like in Ethiopian community, if you come to Ethiopian community in pastoralist area or in agrarian area, one household, when they make coffee, they call the surrounding households, neighboring households, so that at that time, it is a good platform to discuss different problems that they face around. So including the different issues related with marginalized people, vulnerable people, they discuss in that type of platform. So the other one is, there is also the health extension workers, house-to-house counseling and visit, including Women Development Army. It is not actually Defense Army, it is Women Development Army. So they have also a good role in these discussions in dialogue. So these are some of the practical examples from CR WASH. Yeah.
Thank you. So jumping from a participation, I'm going to Carlos next. And can you talk about accountability? So Can you talk about in Ecuador, how are communities and other stakeholders using this participation or other approaches to hold institutions and maybe the mayors themselves accountable?
Yes, thanks. Well, talking about accountability, we can say that the first step is to try to engage the users into these processes that I told you before. So these public dialogues try to identify these entry points, and the success of the Pahani story is that we identify these entry points with the community, with the authorities, and with the local technicians. So that is the first step for a good exercise of accountability. After we identify these entry points, we elaborate a tailor-made solution for the local water and sanitation provider. And we believe that that is a key aspect for the success of this intervention, to elaborate or trying to create a tailor-made solution for this municipality. And we are trying to replicate that. And how does it link with accountability exercise is that if you involve the community from the beginning, it's more easy for them to follow, to keep engaged in all the processes. So in Ecuador, there is a huge challenge in this from the local vision. Remember that the water and sanitation provision is under the central government, so they don't have resources, lack of capacities, etc., and they don't have enough resources to make this exercise, to put some people in the field and help to the community, to the users to be involved in this process. So from our side, from TuMUNI side, we are trying to focus our efforts or resources in this key aspect that tries to keep engaged the users into the processes. So in the future, we have learned that it's very important to identify these key players to can engage the rest of the community, to engage the people, and also the young people. As my colleague said before, politics is it's gonna be with or without young people. So best if the young people is involved. So we don't have to forget them, and we have to train them and try to involve the people into this weird process. But well, we have 4 more years to learn and 4 more years to implement this project, and we are in the right pathway, I believe. Thanks.
Thank you. So we went from participation to accountability and now to Roslyn. My question is about effectiveness and efficiency. Can you talk about what institutional reforms have improved WASH efficiency and effectiveness, and what has been the stakeholder buy-in process?
Okay, so I think for Kenya, the water sector reforms began in the year 2002 with the enactment of the Water Act that basically allowed for or ensured that there is no duplication of roles among the different institutions that provide water and sanitation services. So with that enactment, subsequently, of course, as I mentioned, we had the Constitution of 2010 that led to the devolution of water and sanitation services to the county levels. So as the county levels took up this mandate, at national level, we remained with the Ministry of Water, Sanitation and Irrigation and the Ministry of Health, whose main mandate when it comes to water service provision was basically to legislate, develop policies and also strategies that guide the implementation of water and sanitation with the intention of increasing access, sustainable access to both water and sanitation. Of course, the water resource management aspect also remained at national level. And then we have the Water Sanitation Regulatory Board, WASREB. So the main role of WASREB is just to regulate water service provision while protecting the rights of the consumers. So setting the tariffs, but also have the responsibility of supporting the water and sanitation providers to implement the policy frameworks. Then at county level, we have the Waterworks Development, whose main mandate is to support the development of water and sanitation infrastructure. Other than that, we have the Water and Sanitation Sector Trust Fund, WSTF, whose main role is to support the water and sanitation service providers with the provision of grants, both conditional and non-conditional. Then now at county level, we have the water and sanitation providers who have the mandate to provide water and sanitation services within their jurisdiction or area of operation. So all these institutions have very clear roles and clarity in terms of where to implement interventions and how to complement or support all institutions to ensure sustainable delivery of water and sanitation services. So in terms of stakeholder buy-in, I think for a very long time now, we have non-state actors also just coming on board to support with either institutional strengthening of the various institutions to deliver on their respective mandates, but also to support especially with rolling out of dynamic finance mechanisms. I think starting 2012, I think the very first intervention that started that off was a USAID funded project known as SUWASA, Sustainable Urban Water and Sanitation Activity. So worked very closely with World Bank, mainly to enhance capacity of financial institutions to provide financial packages to water and sanitation service providers. So they supported in strengthening their capacity so that they can have bankable sanitation and water projects. So in stakeholder buy-in has been very good with all actors, especially the non-state actors coming in just to complement what the government is doing and just to ensure that we sustain the gains in terms of capacity building the different institutions and also just strengthening their capacity to deliver on their respective roles. Thank you.
Thank you very much. For those of you who know me, I am an academic, so I could ask a million questions. So if you want to ask your own question, this is now the time to come up to the microphone, or you'll just have to continue to listen to my thoughts. Please, there's a microphone if you want, right there.
Yeah, thank you. I'll put a general question for Kenya colleagues. As we know that implementing policies at the ground is not easy, especially at the start. So when you were cascading the national policies into the counties, have you noticed gaps? If yes, how this project support to fill those gaps? Thank you.
I can. Yes, so as I mentioned, we are supporting these counties to domesticate the national level policies. So first and foremost, counties have very different contexts and very different priorities, because in most cases, you'll find that they follow what is in the governor's manifesto. So if the governor's intention was either just to focus on water service provision, either from a particular percentage, let me give an example of one county, I think Kisumu, it was from 25 to 35% coverage, then that is what they will mainly focus on. But now when it comes to the domestication process, in terms of the gaps, it just has been the priority areas. For example, if you talk about market-based sanitation and menstrual hygiene management, in terms of their context, who will be the key actors? What are the funding streams that they are looking at? So you'll find that probably at national level, it's very broad because they are looking at it from that national level. But when you come now to the county context, they have probably key private sector actors that they have been working closely with, and they also have additional funding streams, because at county level, you have the mandate to actually develop proposals and get funding directly from donors who are able to support you to undertake certain interventions. So that the county government itself, has provided an opportunity for them to actually unlock private sector investments into water and sanitation. So you'll find that either a particular donor would just want to focus on one county. And when they identify that, then they quickly support that development of that policy, because there is no way you can get that financing without a policy. But it's such a long process that is lengthy. And of course, in most cases, you'll find it's mainly donor supported. Like we have been doing this with them really just not playing a very active role, apart from maybe in public participation. But in terms of bringing consultants on board, it is a project that is heavily investing in this. But they're slowly beginning to see the importance of having policies in place, because right now you'll find that there are certain departments that actually don't get allocation. They get zero budgetary allocation. Why? You don't have a policy, you don't have an act. So how are we channeling these resources to a particular department? So increasingly, they're understanding the importance of having these documents in place to support that financing aspect. And they are reaching out, hey, could you please support us, because we have this financing gap and we need this document so that we can do 1, 2, 3 things. But I think right now they're just getting that clarity in terms of how do we budget, because when it's at national level, you sort of think that, yes, the money will go up there and then it will cascade down to us. But right now that responsibility is under you. So they've come to the realization that, yes, we need this, but we also need to think of how do we implement it further. Thank you.
I guess for the other 2 cases, I think the government structure is a little bit different. So if you want to reflect on how localities or municipalities are able to engage where there's a more centralized system, please go ahead.
Okay. Thank you very much. Actually, the question is towards Kenya, but we are neighbors. So in Ethiopia, we have very beautiful policies, strategies in WASH, health, education, and others. But the problem is translating to the ground is a bit challenging. So the reason why this happened is actually with policy, with strategies, there is no earmarked budget which is allocated for execution of these policies or strategies. It's only the policies that is going down to regions, to waradas and others. That is the main thing. The other thing is especially at regional level, at warada level, people, officials are actually assigned in political capabilities. So when they are moving to other places, then the incoming one may not understand what's the policy and also strategy. By the way, we have done a quick capacity gap assessment in WASH actors in regions in Ethiopia, where in 4 regions. So in that case, even there are regional bureau heads or deputy heads or experts and warada level experts who do not know the policy and the strategy. So we have, as CRWASH, we have a plan to familiarize the policy documents and also the strategies to regional and also warada level government stakeholders. So that is the one thing. The other thing I can talk about Ethiopia is One WASH national program is the only strategy or WASH programming which has earmarked budget with consolidated WASH account coming from World Bank, coming from FCDO, DFID, and other donors. So that is coming to one basket, and then that money will be channeled to waradas and regions for implementation, for health, for water, for education, for each sector. So they will use that money and it is going down in successful way. Otherwise, other policies, strategies in Ethiopia is still pending. Thank you.
In Ecuador, it's a little bit, well, similar in some cases, but we have a very particular situation is that the central government allocates the resources to each municipality in Ecuador. according with the size of municipality, according with the population that actually is living in the municipality. And sometimes there are some delays in the allocation of these resources. So municipalities don't have money to perform their responsibilities and provide the services. That's one problem that maybe we can share the same problem. But in the other hand, there is another problem. It's into the structure of the municipality. They only have one account to collect all the fees. No matter is water and sanitation, no matter is solid waste management or another kind of fee. Every single dollar that the municipality collects go to the same fund. So at the end, the municipality are not able to make this difference between the source of the resources and mix every dollar in the same bucket. So we don't have, we found that some municipalities don't know exactly how much does a cubic meter of treated water cost, because they put all in the same budget and they don't receive this investment back to invest in infrastructure or in improvements of the services. So that's a challenge. Sometimes you collect the water and sanitation fees, but you invest this money in another kind of services. And then you are expecting that the central government transfer the resources to cover the operation, the maintenance. So that's a challenge for us under this point of view. So the role of TuMUNI here is to provide technical assistance or advisor to deal with that, or maybe to reform some local policy to allow the municipalities to manage properly this budget, these resources. So remember when I was talking about the 3 types of water and sanitation providers, there are bigger municipalities that they have their own public company. So that allows to the public company to manage their own resources. But it only happens in big municipalities. So these remote municipalities like Pahang, for instance, or successful case, they are dealing with this issue that they don't have a unique account for water and sanitation, and they are mixing all the resources in the same pocket.
Thank you. This is going to be the last question, and you each are going to only have 30 seconds. What is the one thing that you really want to make sure everyone in this room takes away from today's session?
Ladies first.
I think for me is inclusive processes of implementation, just making sure that all actors are on the same page from community level to national level, that ensures that no one is left behind, and we increase access to sanitation and water in all areas. Yeah. Sorry.
Okay. Thank you very much. As the question is a very tough, actually, just to come with one point. So my suggestion or takeaway would be each country has policies, strategies. We need to make sure that the regional structure, sub-national structures are aware of the policies and the strategies, and they need to cascade down to the grassroots level. So that is something I learned as a WASH expert during our WASH actors gap assessment in CR WASH area. So thank you.
Well, I have the last word, I believe. So I think that small and smart investments in water and sanitation could catalyze or could lead structural improvements. That's the idea.
Yeah, if I say my 30 seconds, it's private sector should be more emphasized in the Ethiopian context. As of now, it's government-led. So if we see more private sector coming into the sector, then it will cascade down. Thank you.
Thank you very much to the panelists. Thank you all to the attendees, and I'll just round of applause right now. Please go ahead and enjoy the break. I think that happens now.
Good.
Well done, Wesley.
Well done. Thank you. Thank you very much. Thanks, Kevin.
Thank you.
Yeah.